Okay, for my case, I chose a patient who has right medial knee pain along where the pes anserine insertion is. He's a volleyball player. He notices it most when he's in his low squatting position, when he's ready to pass a ball. So, to start with for assessing, I'm going to have you lay on your back. I first would want to rule out any major injuries, especially like ligament concerns. So I would do a lot of the orthopedic tests to rule out ligaments. So we'll run through some of those quick. So I want to do anterior drawer, posterior drawer, the meniscus test. So I'm going to compress over medial meniscus. I'm going to fully bend. Fully extend. Same thing on the lateral side. Gonna compress, bend, extend, assessing for any pain. Then leg test, I'm just gonna let it drop. The medial and lateral ligaments I can assess by valgus varus, so seeing if there's any excessive movement. And then for the last test, I'm going to put my fist here, and then I'm just going to compress. I'm just going to compress over the quads, looking for that kicking motion. Okay, so now that I've ruled out any major sprains, tears of any ligaments, I'll just go into normal motion assessment. So first I'm going to assess it neutral. I'm just going to move your patella around a little bit, making sure it goes in a full circle just like a clock, checking every direction, S to I, M to L, all that. Then I'm going to look at the little bit of lift it has, so I'm going to cup under it, lift it up. So that's it for patella. For fib head, I'm going to just pull P to A, push A to P, then I'm going to invert the foot and slide it S to I. I'm going to evert the foot, slide it I to S. Then tibia, I'm going to brace the back of the femur, pushing A to P. Other way, brace the top of the femur, pull P to A. Rotation, just going to hold the femur again, rotate. Medial to lateral, lateral to medial. Shifting, so I'm going to brace the femur again, shift medial to lateral, other way, lateral to medial. Then valgus varus, which we already did, but if I hadn't done orthopedic tests, I'd do valgus, varus, and that's it for neutral. Then I'm going to move it up into flexion. I'm going to assess the patella. It shouldn't move a ton in flexion, but again, assessing all the directions. Fibular head, P to A to P. Invert the foot. S to I. And then I to S. Tibia, there's no valgus varus, just shearing, so we'll shear. Shear. We'll do rotation again. Rotate, rotate. And then we'll do A to P, P to A. So that's it for the assessment of the knee. Then based on that, if I found any restrictions through anything, if the fib head felt like it wasn't moving, I could just do a quick little adjustment while I'm doing the assessment so I don't have to backtrack at all. But other than that, then we'll move on to rehab.